Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching a wax removal compilation video today. Two patients in this compilation, so you can see this first patient has a very hard piece of wax at the entrance to the canal. Perfect for the Jobson horn, so we're going to go straight in, take this one away. So you can see as we bend this down, we've got the initial hard section there at the front and then this much squishier, thicker, sticky wax sitting behind it. So we're just going to try and pull this section forwards. We've slowed all this down so you can see this coming out. See how we've the consistency changed there as we pulled that bottom section away. It's a much thicker, stickier type wax. Much sort of more of the sort of fig Newton fig roll wax, the wax that we talk about there. So we're going to go in with the suction now. If we went back in now with the Jobson horn, what would happen is, because it's that much thinner type of wax with not very much structure to it, it would just draw the Jobson horn straight through the center, so you get very little wax out, and what you'd end up doing is re-sticking all the wax to the canal walls then. So you can see we're managing to loosen some of this away. Slowly working this off the canal wall on the one side there, getting rid of all this this much sort of softer type wax. What you don't see obviously in the videos is sometimes when you're getting grips, little bits are getting sucked into the machine constantly. So as we're lifting this kind of softer wax out, what it's doing is it's breaking little bits off, and those are constantly being vacuumed into the tank, you see. There we are. Now we're just starting to lift this up now. It's not budging. It's really stuck on that canal wall. See how that's really jammed in there now? It doesn't want to come away from that canal wall very easily there. There's a little pinch point, a little V at the bottom of this particular ear canal, which is quite narrow. So as we're moving left and right, what's happening is we're sticking to one side of the canal wall, sticking to another. So I've just introduced a little bit of olive oil in here, which is just going to reduce that stickiness to the wax. Also, it forms a layer between the wax and the canal wall. So when you are wiggling back and forth then to remove this, it's not re-sticking back to the opposing canal wall again. You can see we're just slowly lifting this up. There's a couple of little tiny silla which is just obscuring the view slightly, just because of where the endoscope has to sit behind the tool there. It's just at the perfect depth where the end of the camera, the end of the endoscope is sitting just in that kind of bed of silla. Slowly working this up. Can you see there's a little bit of redness underneath that particular section of wax there, where this has been rubbing back and forth. So as we lift it up, you can see it looks quite a little bit sore, almost like a little tiny blood blister under there. If we lift this section again, you may just get a glimpse of it just underneath the suction tube there. You'll just see a little patch of red where that's been rubbing. Slowly working now. We're just starting from the outer part of the ear canal, just slowly working our way back. What I'm looking for here is any kind of peel that we can get underneath this sticky wax, and that's what we're starting to get there. As we lifted that one corner off, we start to get this little bit of a peel to the sticky wax underneath. Just looking at the lay of the land there a little bit, you can see that if we pan back with the camera, you could see just how far back that peel was on the right side there. It's always good to take stock of what you're doing, so just stop just for a second or two and then go back in then. Have a good look around, see if there's any looser bits we can kind of exploit to get this out. So you can see now I've put the olive oil in again, trying to loosen this bottom section here. I'm staying just above the canal wall because I've spotted that sore bit in there, so I don't really want to touch the canal wall if I possibly can. We're just using the fine end here just to suction up more of the olive oil, because imagine the olive oil just distorts your perspective just ever so slightly when you're coming to clear the canal walls. So I'm trying to suction as much of the excess oil up, leave a little bit in there. So you can see now we're starting to peel down, look, from the top left hand corner. So this is coming down really well. Slowly pulling this down, trying to draw it across. Now you've seen the size of the fine end, so it'll give you some appreciation to the narrow point of this ear canal here, just in front of the eardrum. So we can't work too close to the eardrum. We haven't got much room to sort of wiggle back and forth. Slowly trying to grab this last little bit. Now, some patients do move a little bit, which is what's happening here, which is why you're seeing that ever so slight kind of vibration to the camera there. Now, we've pulled that section away from the left-hand side. As we draw this away now, I'm trying to get it away from the eardrum. There we are. Trying to get this, hoping this bottom section will stay attached as well, which will give this a good pull forwards. There we are, so that's gone. Let's take a look behind there. So we've cleared that left-hand canal wall. Look at that little blister there. Look, see to the left-hand side? That little raised section. We're pulling across now from this right side, slowly drawing this in, peeling away. You can see it's all starting to peel away really nicely. Thank you to everyone who's taken part in the poll so far this week. I am going to put another poll on now, which should pop up in the corner. So if you can just vote on that poll for me, because that's going to determine how these videos are going to look moving forwards. And I really want to do what you want to see, guys. So if you could take part in that poll, that would be absolutely fantastic. The results of the poll we'll look at the end of this week. So what we'll do is we'll then decide what was the most popular format, and we'll move forward with that particular format. Okay. So please, if you want your say, vote in the poll. Okay, so we just got this last bit now. As we draw it away, the olive oil's done its work. It's loosened that last section there at the base of the canal. That started to come away really nicely. A little bit of hair there. Just trying to get a grip with the suction tube. It just detached on the way out. You can see how sticky this is. It doesn't want to come out. There you go. Just stuck to the canal wall look on the way out. So really sticky type of wax there. A little bit of dry skin. So let's take that away as well. You can see that just starting to flick up into the suction. And there we go. There's the eardrum there. So no light reflex there. Skin kind of bluey grey in colour, so a little bit retracted as well maybe. We can see here we've got 1 inch, which is 2.5 centimetres worth of wax there. So quite a bit out of that ear canal. And all that kind of rich golden colour. So this is the second patient in the compilation. Look at the colour difference between these two waxes. We talk a lot about colour, and you know from past videos that you get this really kind of deep colour. When the wax is a little bit older, it's oxidized just that little bit more. The keen-eyed amongst you will notice that there is some wax already on the Zollner tube before I put it in. It's because we just did a very quick clean on the other side, but the patient does need a follow-up on that one, so I'll post that one another day. But this is the second ear now that we're doing. So you can see we're trying to get a grip on this. We're getting lots of this kind of thick, sticky, more kind of fig Newton filling wax at the moment. There's lots of patients coming through this. I think it's just down to sheer kind of desperation. A lot of people have been introducing sort of oils and trying lots of home remedies to try and help with their wax until they could get this done, and it does kind of alter the texture a little bit. Some people naturally produce this type of wax, but for a lot of patients it's because they've used a bit of olive oil then stopped, or used drops then stopped, so you get this kind of constant changing in consistency then of the wax. So there we are. You can see all this is really starting to come away perfect. Got a nice big chunk away then. So we've cleared this front section of the ear canal, but you can see there's this deeper section there. All these tiny little hairs from hair trims. Basically, it's from lots of people trim their outer ear hair, especially as we get a little bit older. As gentlemen, we tend to find we get a little bit of hair growing out the ears. That's what they've been doing here. So all those little pieces have gone back into the wax, embedded in there. Just slowly pulling this away. With those little ear hairs like that, a lot of people ask me questions about these. If your ear canal is pretty clear, when you have your next bath or shower, they'll wash out. All right, you really don't need to worry too much about it. It's only if you get a lot of wax, you can see that it embeds into that wax then. So we've got this last section, quite deep, so sitting just in front of the eardrum. Let's see if we can get a good grip on this now. There we are. So we've got the grip, holding on to it, it's pulling some of these hairs out with it. Slowly working this out. There we go. And we'll take a look behind that. There we are. There's the eardrum. Also looking quite dull. Lots of dull eardrums today. So this is what we can see. So this, you can see the hair-filled lumps there. 2.5 centimeters, about 1 inch there.